Like and subscribe and click the bell icon to get new video updates.
Tasmanian Paramedic says immense pressure on ambulance service putting community at risk. An experienced paramedic has described how a patient who was taken to the Royal Hobart Hospital after a mini-stroke had a second stroke while being kept waiting in a hospital corridor. A senior paramedic says morale at Ambulance Tasmania is the worst they have seen, with stress, long hours and missed meal breaks putting staff and the community at risk. A health union has expressed alarm in a letter to Ambulance Tasmania's chief executive, after several staff members broke down, when asked how they were. The paramedic, who spoke out on condition of anonymity, said the patient was waiting on an ambulance stretcher in the hospital corridor, a consequence of ramping, where paramedics become trapped in emergency departments caring for patients because hospital staff cannot take over their clinical care. Staff were alerted that a waiting patient had suffered a stroke, but the wait in the corridor continued for another hour. The experience was extremely stressful, according to the paramedic, who has been in the industry for over a decade. They were only 30 meters away from the CT scanner. The definitive care is within arm's reach, the paramedic said. The patient needs a scan to confirm whether it is either a bleed or a clot. If it is a bleed, you are within the facility where they can be potentially admitted to surgery, or if it is a clot they can be taken into a resuscitation bay and have the clot dissolved with the same ED. Theoretically, UCOULDNT have a stroke in a better place, but the frustration is, there is no capacity. The paramedic said the incident happened a little over a year ago, but the reintroduction of COVID-19 to Tasmania since had only worsened the stress on an already strained system. Space to play or pause, M to mute, left and right arrows to seek, up and down arrows for volume. The paramedic said ambulance staff shortages due to underfunding were being exacerbated by illness and COVID-19 exposures. They said they decided to speak with the ABC because staff were being pushed harder than ever before, and they feared for the impact it was having on staff and patients. Read more. Overtime and missed meal breaks are a daily reality for many paramedics, the insider said, and the extra time needed to clean equipment and vehicles between patients was forcing ambulance staff to rush from job to job. When night shifts are 14 hours long, having to do a late job could easily mean a 16-hour shift, the paramedic said. IWOULDNT know how many times I've done that. We really put ourselves, and therefore the community, at risk when you've got staff driving around, trying to implement patient care after such a long shift without adequate breaks. Because paramedics must be paid compensation for overtime or missed meal breaks, the system was extremely inefficient from a cost perspective, they said. The ambulance service is constantly under immense pressure. It is amazing how often you get by just by the skin of your teeth. You literally have no resources. And it is quite scary. I don't think people realize just how stretched so many aspects are, not just the ambulance service, but the hospitals in general. The paramedic stressed that hospital staff were not to blame for wait times. But the strained system was hurting paramedics badly, and morale amongst Ambulance Tasmania staff was now the lowest they had seen in their career, they said. We're seeing the signs now of gross underfunding of the health system over a long period of time. If you had to point a finger of blame, it would be at both sides of politics, whether you're talking about infrastructure or policy. There are lots of things that fall into the too hard basket. We have felt their increased stress. Documents seen by the ABC show leadership at Ambulance Tasmania described the workforce as under extreme pressure during 2 periods in March when there were large peaks in the hours ambulance staff spent ramped at Tasmania's public hospitals. The high demand for ambulance and emergency department services, combined with a large number of hospital staff furloughed due to COVID-19, saw ambulance staff stuck waiting to offload patients for so long that management escalated their concerns to the Secretary. Royal Hobart Hospital emergency medicine specialist Juan Asensio Lane told the ABC they and colleagues across the state were aware of high stress amongst the ambulance workers. We work extremely closely with the paramedics and we certainly do see when the workload has increased, said Dr. Asensio Lane, who is also SMS Tasmanian faculty chair. We have felt their increased stress over the last year, and have been in constant communication with their Chief of Operations and other managers regarding how we as an emergency group can improve the situation.